Hey everyone, Billy from Performance Unlimited. I'm here with Anya Wallace from Companion Health, and today is really all about talking about how hormones is potentially affecting your life, whether maybe you're struggling with weight loss or you're wondering how exercise nutrition is affecting your own hormone challenges you're having, or maybe you have some other questions like your doctor just told you had low testosterone. All those things we're going to cover today, and I'm really excited about having Anya here. So Anya, give us the background on you first, at Companion Health now, kind of give us your rundown of how you've gotten here.
So my name is Anya Wallace. I'm a physician assistant at Companion Health. I have been there for about a year, but I've been practicing medicine for 6 years now. I've really had a focus in hormones for the last 3-4 years. It's a big passion of mine, both in men and women, but yeah.
Yeah, today is really specific to the male side of things, and we're going to go over and cover a lot, but let's start with this idea of hormones. Why should someone even care? What's the role and what do hormones mean? Again, we mentioned earlier at the beginning, whether I'm struggling with weight loss, whether I'm just an avid exerciser, like why should I even care about this stuff?
Yeah, so hormones will kind of take a backseat to that. So hormones in general they're chemical messengers in the body. They are responsible for basically any physiological process that happens. So that's your heart rate, blood pressure, sleep, even pain, energy, working out, muscle mass, fat loss, all of that comes from hormones. So they are a big deal because to properly regulate the body wants to stay in this thing called homeostasis, which is it likes to stay in its little bubble. So anytime anything major happens, the body wants to go back to normal. So let's say you've been working out super, super hard and your body, you're tired, you wake up the next day, everything hurts, but you're like, nah, I gotta keep going. Your body is literally telling you, no, you need to chill out. That is a hormone messenger that's happening. So that's, your tissues are tired, like your muscles hurt, that's all because of hormones. You're super hungry, that's all because of hormones.
So basically, they are the regulators of the entire body. So whether those are certain things we're feeling, whether those are certain reactions we're having, that's these messengers, as you called it in the beginning, hormones, that are being communicated and sent throughout our whole body by our brain is driving this whole process, right? And among other things, but it kind of keeps us moving forward and doing the things that we love to do, right?
Pretty much.
So let's talk about nutrition and exercise a little bit. How does this, let's start with the nutrition side of things. How does that affect hormones? And why should we care?
So nutrition is important in everything. So if you take it all the way to the basics of proteins versus carbs versus fats, those coming into the body are going to signal different things in the body. So like if you look at hunger hormones, if you are protein deficient and you take in all this protein, your body's going to be happy with that, you're going to be satiated, those hormones chill out. All the way to looking at like organic foods, non-GMO foods, and kind of some of the nuances of that and altered cell signaling that happens, those are still all hormones. So based on the nutrition that your body actually needs, your body's going to send these signals out saying, hey, you're hungry, or hey, you're really tired, and it's going to tell you what you actually need if you pay attention to it.
So if I am struggling with, let's use a common problem I'm sure you all see, and we do as well, is weight loss, right? If I am struggling with weight loss, that could be due to potentially imbalances, or that could be due to issues that from a hormone standpoint?
Oh, definitely. Some of the biggest things we see in terms of hunger is abnormalities in two specific hunger hormones, one called leptin, one is called ghrelin. Those are big driving factors in terms of people feeling the need to eat. Even if they're not hungry, it's just a signal that happens and it gets all messed up whenever there's too much fat or something going on in the body.
So these hormones are responsible for me feeling like I need to eat something right now. I'm starving, I need something right now. That's the hormones basically telling my brain that I need some sort of food within my body right now. And so it's not necessarily, weight loss isn't a discipline issue. It could be, as you mentioned, a true hormone problem that we are unaware of that's affecting our cravings and different things along those lines.
Yep, exactly.
So the recap on all this and why this is important is, you mentioned at the beginning, chemical messenger throughout the body that's regulating everything that we do. All the fun things we want to do, like exercise, all the things like we want to go for a hike, or certain goals that we have. We got to be aware of how hormones are playing a role in all of this. We know one key piece of that is the nutrition side.
Yeah.
We can use nutrition as a tool, as a resource to affect how our body is regulating itself, right?
Yeah.
I mean, would you say that's a good kind of recap of all that right there?
Yeah, pretty much, yeah.
So let's then talk about the next piece, because we got to assume that a lot of the people that are listening here are doing some sort of exercise.
Yeah.
How does exercise affect hormones in this whole thing?
So if you look at kind of men specifically, they've done a bunch of different studies looking at everything from aerobic exercise over the course of a year, so that's your running, swimming, biking, all of that, all the way to resistance and weightlifting, and they did it course over 3 months, 6 months, 9, and 12. And they looked at different age ranges as well. So if you're looking specifically with like aerobic exercises, you will actually see an increase in a hormone that's called DHT or dihydrotestosterone, and then actually a hormone protein called sex hormone binding globulin. And those are important in relation to testosterone specifically. Sex hormone binding globulin is kind of this protein messenger, and that unbound and like able to do stuff in the body will bind to. And so if there's an abnormality with that, it will throw off your testosterone.
Does exercise potentially affect abnormalities, or is that abnormality that you mentioned there caused by something else?
It's usually caused by something else. Exercise can, in the sense of if you are actually over-exercising, the body will kind of compensate and try to turn it down to try and get you to back off of that. If you're looking at resistance and weight training, you will see actually this increase specifically in testosterone and as well as growth hormone. Growth hormone is important for everything in the body, but in men especially, it's important for that testosterone.
So if I'm hearing you right, exercise is plays a key role
Yes.
in setting us up for success
Yes,
as it relates
it's a
to
big
hormones.
deal.
And you mentioned testosterone, which I know is a huge one
Yeah.
as well. But you mentioned at the beginning of that, this idea of aerobic exercise. I think in simple terms, think of our cardio of sorts versus more resistance strength training type work.
Yeah.
Is there differences in how those affect hormones throughout the body?
Yes, there is. When you look at it in kind of the overtraining aspect, both of them you're going to get beneficial effects. Weight training specifically, you're going to have more increases in kind of what men generally are looking for, so like that increased muscle mass and a decrease in fat. Aerobic exercise, you can see it where there is an increase, specifically, like I said, in that sex hormone binding globulin and dihydrotestosterone, but it's not going to increase testosterone. Specifically, it will start to kind of generate the stuff that needs to happen, but not specifically just with that.
And you mentioned a potential detriment in this whole cycle of too much. Does that relate to just aerobic training, or is that both aerobic and strength training?
Both.
Of overtraining can play a role in this?
Overtraining everything.
Yeah.
So basically an overstressing of the body in general. So that can be lifestyle stress, that can be work is crazy, you're in a fight with your family, whatever it is, all the way to the no days off people, like me. That's a huge issue. You'll see the body will actually start sending out signals, specifically cortisol. Cortisol is coming from the adrenal glands, and cortisol is your stress hormone, whether it's good or bad stress. And as the body's taxed, it keeps like sending it out. And if there's too much cortisol, it will bind to free testosterone, which, like I said, that's the stuff that's out and about doing stuff in the body. It can mess your testosterone or with your thyroid, all of that too.
So, and you hit a great point. Not all hormones are necessarily good hormones, but it's all a feedback loop in a lot of ways. So, and again, I think the key piece is it's all trying to regulate the body to continue to allow it to do the things that it wants to do. But now, we've talked a lot about testosterone and exercise relationship to that, because we know from a male perspective that's a huge piece, especially with the prevalence of low T, right, or low testosterone. But you also brought up a good one, which is cortisol. And so let's dive into that, because we haven't really talked about that yet. So what kind of role does cortisol play in all of this? And you mentioned this stress hormone of sorts. Is it prevalent? Is it not prevalent? Why should I care about cortisol if I'm a male?
Cortisol is a huge issue. So with men specifically, two biggest things we see is testosterone abnormality and cortisol abnormality. Cortisol both affects several things in the body and is affected by several things in the body and life. So this is kind of like your fight or flight thing that you hear. There's some neurotransmitters involved with that as well, but a lot of people think of cortisol as almost kind of like adrenaline. You get this adrenal response. So this is like, you get like an adrenaline dump if something happens, you're like caught off guard, whatever.
Where are the adrenal glands? Just so
Yeah,
people
adrenal
know.
glands sit on top of your kidneys.
Okay.
Tiny little,
For sure.
little bean looking thing.
Yep.
And any response that happens in your body, so if it's a hard workout, or you woke up super early, or we ate bad foods, even that can do it. Too much sugar, that salty, sugary cravings that people get, it's all from cortisol. It's super important to help manage everything else in the body. So you will see these natural peaks and troughs that happen throughout the day. And a lot of times those normal peaks and troughs actually end up backwards. And so people are super tired in the morning, brain fog. They just feel like they're literally running through water. And then at night, they're super hyped up and they can't sleep. And it's because this cortisol is high at night when it should be low.
Gotcha. So there's a natural ebb and flow to cortisol. Is there a natural ebb and flow to testosterone?
Yeah, so like you said earlier, there's feedback loops.
Yeah.
And so those feedback loops respond to different stimulus in the body. So if cortisol is abnormality, or if there's an abnormality in cortisol, there's gonna be an abnormality in testosterone because it's gonna go and bind to that stuff that we need. And so if that one's off, this one's off, which then incorporates with this one. And so you see all these issues that intertwine.
So if I'm hearing you right, there's an inverse relationship of sorts between cortisol, high cortisol, and testosterone.
Yeah,
as
there
well.
can be.
Yeah.
Not always necessarily, but there can be.
So I think let's play a hypothetical game here. Hypothetical would be that if let's say I was a perfectly functioning human being, that I would naturally see this ebb and flow of testosterone and cortisol throughout the body.
Yep.
But, and I think often why we start to see issues from a hormone standpoint is we as humans naturally do things that affect the natural flow of what this should look like.
Yeah.
Nutrition and exercise, like we talked about.
Yeah.
So, okay, we've talked about overtraining a little bit. We've talked about the role of nutrition in all of this. A common thing we often see is low testosterone in males.
Yes.
Right? That's one of the most, well, I'll leave it to you. I would say
Yeah.
one of the most common things that I imagine you all probably see, right?
Yeah, so that's kind of the biggest thing that men will actually come in and talk to us about. They aren't coming in for, I think my cortisol is abnormal. They're coming in saying, hey, I'm really tired. I can't function like I used to. I'm losing muscle mass even though I'm working out the same. My workouts feel harder. I'm gaining weight. Specifically, you'll see in men this increase in visceral fat. So like that's kind of, I call it the beer belly. You see like just this protuberant abdomen. And that's a big thing. You'll see decreased sex drive. You'll see erectile dysfunction. Those are the biggest complaints we get. And then we kind of take that and we look at, okay, well, why is this happening?
Yeah.
Is it age? Is it stress? Is it there's truly something going on that there's causing this issue with the low testosterone?
So if someone's having some of those things that you mentioned, and could that be something else? Or is it very common that, hey, you're seeing these things, you have low testosterone?
It could go either way. Everybody's different. In the younger generation, we tend to see it's more related to cortisol or there's something else that's driving that abnormality in testosterone. Once you get to like 45 and above in men, it's usually truly a testosterone abnormality, but a lot of times there is that interplay of cortisol or thyroid or something else that's going on.
So should someone, if they're having, is it all of the things, a couple of the things that you mentioned, what is the kind of stoplight to say, okay, I got to do something about this right now?
So the biggest thing people will come in is, like I said, with men, it's almost always a sexual dysfunction, and then weight gain and the decrease in muscle mass. Those are the biggest complaints we see. The biggest issues for us tends to be, okay, your sleep is now garbage, and that's usually a driving factor of an issue with a lot of other things in the body, so cardiovascular disease, blood pressure, heart rate. You'll see all these men with what we call metabolic syndrome, so insulin resistance, or it's leading to other issues in the body, specifically diabetes or blood pressure or heart arrhythmias or cardiovascular disease.
So it seems like, from what I've heard from you, the big three is kind of nutrition, exercise, and sleep. If you can, and I know we can throw stress in there, right? As that's a key piece. But it seems like those first three, if we can focus on those, that we are setting ourselves up for a better chance to not only, let's be careful how we define health, right? It's different for each person, but from an overall testosterone standpoint, a hormonal standpoint, we're setting ourselves up for success if we can manage appropriately those three things. Would you say that?
Oh yeah,
True?
absolutely.
So all right, I'm having some issues. I need to take next steps. What's the best option for someone that is potentially struggling with some of the things that you mentioned? What should their thought process be of, okay, I think maybe I'm struggling with some of the things that you're mentioning here. Where do they go?
So you can come to us.
Yeah.
But honestly, the way I practice, what's easier for me if people come in with just this list of, these are all the things that's going on with me, what does it all mean? Versus saying, hey, I think I have low T, because then you have to go back and kind of tease it out. But if somebody comes in and they're saying, hey, I'm having trouble in the gym, I used to be a collegiate athlete, whatever it is, and the same workout, I'm just struggling. Or I'm so tired and everything is harder than it used to be. I'm gonna start to go through kind of these questions with them and like, okay, well, what about your sleep? What about your nutrition? Go through all that. And then from there, we can look at testing. So testing for that is a combination of blood testing, and then we also do salivary testing. Salivary testing lets us look at some of those peaks and troughs that naturally happen throughout the day, specifically cortisol, DHEA, which has to do with your testosterone, testosterone as well, estrogens as well.
So you get this blood work back, and then what is often the next steps from there? So someone says, hey, I'm having some of these issues. They come in, you guys decide, hey, we're going to do some of this blood work, we're going to do some of the salivary testing, whatever it is. Here's what we're finding. Is your first step typically nutrition, exercise, sleep related? Is there some other options? How does that process typically go?
So I'm a big advocate for always incorporating all of the lifestyle things.
Yeah.
Even if somebody comes back like, yep, tried and true, you have a testosterone deficiency, we replace it, good to go. But nobody's perfect, especially when it comes to nutrition and exercise and sleep, especially with today's society of just, I need to be super successful, and if my sleep suffers, fine. That's so I like to incorporate all of the nutrition, all of the exercise, some of the de-stressing and the sleep habits, things like that. Our awesome health coaches work with patients on that, and they really kind of get into the nitty-gritty of all the lifestyle stuff. In terms of replacement, you've got everything from topical creams to injections to what we call pellet, which just goes a little bit beneath the skin and lasts you for a couple months. It's individualized person to person.
When do you go to that route? When should someone consider making, whether that's an injection, a topical, when should someone say, hey, that's the next route that I have to go?
So that's a discussion that you kind of need to have with your provider.
For sure.
And what we do is we kind of weigh the pros and cons of it. So if you've got somebody that is having metabolic syndrome and all these other things, we're going to kind of push you a little bit to replace it, especially if you've got these low numbers and you're struggling with a lot of things in life. And especially also if there is a cardiovascular disease component. There's this common misconception with this huge risk of testosterone replacement and actually increasing your cardiovascular risk, where actually if you have an issue with your androgens, so androgens being your testosterone is your main one, they're actually an increased risk of cardiovascular disease. So I like to kind of push people that way if it's necessary.
Talked a ton about testosterone, and I think understandably. Are there, and we had a little segment there on cortisol, but are there other hormones, and I think those are the big players, but are there other ones that are also, you think, just as valuable? And it's all valuable, right?
Yeah.
So, let's be careful there, but are there other ones that you think are the major players in this whole process that males specifically should be focused on, should be aware of, should be understanding the potential side effects of their lifestyle and how it's affecting these certain things?
Those are honestly the two biggest ones from a non-medical person. I mean, we are looking at some of the finer nuances of like that DHEA that I mentioned, that dihydrotestosterone that I mentioned, because those play into, is your prostate at risk? That's your dihydrotestosterone. DHEA also comes from the adrenal glands, so if there's an issue there, maybe the adrenal gland is the issue. So there's little nuances of things that we look at, but it's not necessarily something that somebody is going to know about coming into us. So.
Let's kind of come out a little bit. Let's go, and let me ask this question. The grand scheme of things, right? I am a male that's working, I have kids. When should I really start to focus on some of the things that we mentioned? Is it right away? Like if I'm chronically tired, let's say, right?
Yeah.
I'm always tired. I feel like work's always a little bit stressful. Should I be worried right then? Is there a certain age I should really be focused on this? Or is it, man, if you're chronically suffering some of the things that we mentioned, like you gotta
Yeah.
get in and see someone.
Yeah. I'm a huge advocate for being proactive. So, here and there, like if you're recovering from being sick or something like that, and you're just like, I'm a little tired, and it's variable in how bad it is, then I say you can kind of watch it. But if it's something where you're just struggling every day and everything seems exponentially harder, then I think you should be seen. You should be evaluated. And it's a discussion to have with your provider.
Yeah.
That discussion doesn't necessarily tie you into, okay, I have to be treated now. You can sit there, you can think about it, you can ask questions. It's super important to me for patients to understand what's happening versus just being like, hey, here you go.
Yeah.
Age-wise, it's going to vary person to person. Most of the time, we start seeing men around 40-ish because they see a commercial or their buddy's on testosterone or whatever it is. You can't come in too soon. I mean, honestly. I mean, if you're like 15, that's different. But if somebody comes in to me and they're 27, they're like, I'm just super tired. Okay, cool. I'm still going to evaluate it the same way. It just may not be testosterone as the issue.
What are some of the classic myths of like, I think intuitively, especially, years ago, this become more prevalent, so I think there's more awareness around it, but, testosterone, is that like steroids? Or how, what are some of the classic myths that we see that we can say, okay, well, those aren't true, here's where you should be going from here?
So some of kind of like the gym steroids, they are technically testosterone, but it's like black market testosterone, and it's in crazy, crazy high doses. Then you've got people also supplementing with like thyroid and growth hormone and all of that. That's completely different than medically responsible hormone replacement. Testosterone, yes, it's still testosterone. It's just in a slightly different form, and it's at significantly lower doses. That's probably a big one, especially with like gym bros coming in. The other one is, again, that cardiovascular disease. What kind of happens with medical research is you see these peaks and troughs over 5-10 years of no, it's bad, yes, it's good, and keeps going back and forth. But probably for the last 20 or so years, it's been consistent on, no, this is actually good for you when it's done responsibly.
So let's kind of go to our, I'll call them the big three for the sake of ease, nutrition, exercise, and sleep. What are some things as a male that I should be focused on from a nutrition standpoint that can set me up for success as it relates to hormones?
So going back to the basics of proper nutrition, and I don't mean like food pyramid, I mean the proteins, carbs, fats. And it doesn't mean to track your macros or anything like that, but it's also paying attention and listening to your body. So if you are starving after you eat a bagel and an hour later you're like, God, I'm so hungry, but I had that bagel, it's probably too many carbs. If you have a protein shake, you're like, you know what, I'm good. Don't eat necessarily if you're not hungry. It's paying attention to what your body is actually telling you.
I know there is some correlation between, under consumed calories and its relationship to low testosterone as well. Do you want to touch on that and what exactly that means for the people that maybe are constantly doing the crash diets, that are constantly feeling like I can't eat anything? Well, hold on, maybe that's not the actual best route to take.
Yeah. So if you've got somebody that's in a super low calorie diet, or they're doing fad diets or keto or whatever it is, it stresses the body. So you're going to get that cortisol response, especially if you're in a very calorie deficit. You're going to start actually pulling from your muscle. You need that protein. Your body needs all those nutrients. And so your body, because it needs those nutrients and it needs to break them down from within your body instead of food sources, it's going to send out hormone signals. So you're going to get a decrease in testosterone because now you're dropping a bunch of weight and the body wants to stay in that homeostasis. If you think about the actual purpose of a human body, it is to reproduce. So if you aren't able to survive on your own, your body's going to shut down the ability to reproduce, and that's your testosterone as well. So,
what about the exercise side? I mean, we touched on it a little bit, but it sounds like continuing to stay active, continuing to include a balance of both aerobic exercise, resistance training. It sounds like that moderation of all of that is probably the best answer. But I mean, give us some insight of how do we set ourselves up for success as it relates to exercise and its role in hormones.
So, I mean, it's basically everything you said. It's all about balance. And again, listening to your body. So if you're waking up and like you're walking like a baby giraffe, okay, maybe don't do legs that day. Maybe back it off, like do mobility. Something where you're still moving, but you're not putting excess stress on the body. Those are, I mean, it's honestly that simple. It's simple in concept, but it's not necessarily simple to do because people are constantly wanting to just drive and push through.
It's behavior change, right? Yeah. And we know that's what this whole thing is, right? Let's dive into sleep, and I don't know if we touched on this as much, but how and why does a lack of sleep or the proper amount of sleep either affect hormones in a positive or negative way?
Yeah. So sleep is super important in your endocrine system. Everyone has kind of heard about Rem sleep, and they think deep sleep and Rem sleep are the same thing. They're not, actually. One is responsible for kind of letting your brain rehabilitate, and the other is responsible for your body rehabilitating. So those normal peaks and troughs that are happening during the day, the same thing is happening at night. So it allows your body kind of to reset. And if you're getting poor sleep, or even if you binge drink the night before, that's going to mess with your REM and your deep sleep. So you're not actually going to get good sleep, and your body isn't going to recover the way it needs to. That's really the biggest thing when it comes to endocrine system.
Does that promote a higher level of cortisol within the body, like you mentioned, a lack of sleep?
Yeah. Oh, yeah. Yep. Yeah, so one night isn't so bad, but if you were chronically not sleeping well, your cortisol is going to be all messed up, especially if you're already having this peak cortisol right before you go to bed when it should be nice and low. It's just going to kind of further this like snowball effect. So
yeah, huge. Well, let me ask you this. I mean, if there were a couple things, 1 to 3 things that you could leave any male of any age, but really in that 30-plus age group, if you could leave them with these couple things, hey, if you took 1 to 2 to 3 things away from this whole discussion, it's this. What would those be for you?
Honestly, the biggest thing is going to be stress management. That's so important for so many things in the body, but especially with hormone balance. I would say that's a big thing, and I think men tend to want to be like, no, I got this, I can do it, I can push through, but that's really kind of the opposite of what you want to do. You need to kind of reel it back in when you need to. That, and then if you just feel like everything is harder, whether it's mentally, physically, it's probably time to kind of look at why that's happening. Whether it is just figuring out for yourself and like, okay, I don't know anymore, go see somebody. The other one, it would probably be just balancing everything. Like we talk about everything in moderation. So that applies to, you don't want to oversleep, you don't want to undersleep. You want to eat correctly, you want to work out correctly. And I mean by that is don't overdo it, don't be lazy. It's kind of the big things.
How would you encourage someone, because I think this is always the golden question is how does one balance all that, right? Because I think everyone has a different governor of sorts. So how does one know, okay, I'm probably overdoing this a little bit. Or, okay, I'm pushing here a touch, but I'm actually doing okay. Do you have a strategy? Do you have a thought process or questions that someone can answer to know, okay, I'm overdoing it right now or I'm in the right spot?
So I talk about it all the time, but listening to your body is honestly the number one way you can do it. And I think that's really hard in today's society because there's food everywhere that we go. Like you drive a mile and there's fast food places everywhere. There's a constant need to just drive and do better and do more. And so your sleep suffers or your stress suffers, whatever that is.
So if you could recap this whole thing, what would be your biggest takeaway? Why should someone care about hormones? Why should someone care about testosterone and cortisol? Like, why should I care as a male about this whole entire conversation?
So, balancing of hormones is super important to not only physiologically functioning efficiently, but feeling better. Nobody likes to feel bad. So, if you want to look at it from strictly medicine, strictly body functioning, it's important to have a balance of hormones, to have a balance of testosterone for not having diabetes, not having blood pressure issues, not having heart disease. But then also, you want to feel good. You want to enjoy life. And if you're always hurting, you're always tired, you're having trouble even like thinking, then you're going to have issues with being efficient at work. That's a balance of hormones.
And I think it comes back to what we started this whole discussion with, right? If you're struggling to lose weight, if you are struggling with mental acuity, if you're struggling with sex drive, if you're struggling with just like, I don't feel like I can do the things that I used to do, it's that it might not be because you're not working hard enough. It might not be because you're not in the right plan. It actually might be that there's some stuff going on inside of your body that isn't doing what it needs to do, which is ultimately affecting your output.
Yeah.
And so I think it's easy to assume weight loss and things like that, I'm eating too much, or portion control and those things, but we know it can actually be way more than just that.
Yep.
And I think the segment we talked about as it relates to low testosterone, because that is a prevalence among males, I think is huge. And I think what you mentioned as well of this idea of, well, if you're struggling with these things, seek out an expert.
Yeah.
Right? Whether it's companion health or anyone,
Yeah.
like seek out an expert, someone that can at least look at where you're at and say, here's what we're seeing and here's what ultimately needs to change.
Yeah.
Because I think we're all biased in our own sorts of
Oh, yeah.
way, and we struggle with awareness around specific things.
Yeah.
So, well, this is awesome. I really enjoyed this, Anya. Is there anything on your end that you want to leave anyone watching here with, or any final thoughts to close this out?
Yeah. Like I said earlier, I'm a big advocate for people understanding what's happening. And so I tell people all the time, like, even if you don't come see us and you go see somebody else, like, especially with like certain clinics that are out there, ask questions. Like, don't be afraid to ask questions. If somebody shoots you down and you're just like, no, do this, I wouldn't go there.
So let's go on that for a second. Is there a major red flag that someone, okay, let's say someone has gone to, whether that's a general physician or anything, use some sort of service and is struggling with this. Is there a major red flag to say, this might not be the right place for me?
So the biggest kind of issue, and this is what gives testosterone a bad name, is it's not monitored correctly. So you should be getting labs or seeing a provider, or having a conversation with your provider at least every 3 to 6 months. So if you've got somebody that's just like, here you go, here's your prescription, I'll see you in a year, that's a huge red flag.
Gotcha. Good enough.
It's really important to monitor those hormones, because if they're too high, that causes issues. If they're too low, then you're not getting adequately treated.
Yeah.
That's honestly my biggest pet peeve when I see hormones being replaced, is they're not monitored correctly.
Yeah, that's huge. That's huge. So if someone wants to come to Companion Health, what are the next steps from there?
Yeah, so you can find us online at www.companionhealthnc.com. There's a whole bunch of information on there about us, as well as a little questionnaire you can fill out, and it'll come straight to us. Somebody will be in contact with you usually within a day or two, whether it's myself or somebody else in the practice. You can email me directly. It's Anya, ANYA, at companionhealthnc.com. You can give us a call. I don't know the phone number. Sorry.
No one uses phone nowadays anyways, right?
Those are honestly the easiest ways to get in touch with us. Even if you don't decide to come hang out with us, we'll be more than happy to give you a talk to. Awesome.
Well, we appreciate you. Obviously, I'd be remiss if Performance Unlimited didn't cover the physical side of things for you as well, because we know that's a critical part of this whole process. So we appreciate you all staying with us, and please send us questions our way.